today on Liz, we're going to do plasma fibroblast treatment. And what plasma fibroblast is a non-invasive skin tightening modality. It's little tiny carbon crustacean burns that are put on the surface of the skin in a specific pattern, and the skin will regenerate into those holes, and it actually will give a lifting, tightening effect, smooth out any fine lines and wrinkles, get rid of sun damage, acne scars, large pores, stretch marks, tattoos. It is endless. So I'm so excited for Liz today. We're going to work on the forehead, the eye area, large pores on the nose. We're going to give her a lip lift. So we're going to do around the mouth. Even there's a line on her neck, so we're going to minimize that line, really define her jawline, as well as some areas on her stomach. She has a few stretch marks, so I'm so excited for her. The downtime with something like this is only a few days, 4 to 5 days, and she'll be looking years younger. So plasma fibroblast is my all-time favorite treatment, and what plasma fibroblast is beneficial for is obviously the number one thing, skin tightening. So it can be done, again, anywhere on the face, the neck, and the body. As well, there's other things that this modality can do. It can get rid of acne scars. So if you have currently, acne scars from when you were in high school and you're now in your 30s and these pick marks are on your face and you can't seem to find a treatment that's going to resolve them, yes, then you're the perfect candidate for this treatment. If you have flare-ups at the moment, I don't recommend doing plasma fibroblast until we can kind of minimize those flares and get those subsided. So we want to minimize any kind of active acne that you have going on. And I know with everyone wearing a mask right now, we're all breaking out in this kind of mouth region, and it's very, very frustrating. And so plasma fibroblast is perfect to help kind of shrink those oil glands in the skin and kill any kind of bacteria, but we don't want to go over, again, active acne. The stretch marks, so moms, hey, we can totally treat your stomach, loose skin from having babies. We can totally minimize that. You don't need to have a tummy tuck. It can treat around the belly button. So if you have, had piercings, things of that nature, we can kind of tighten that all up. We can do the arms. So again, especially as ladies, our arms and our neck is what ages us. We can totally get rid of sunspots, freckles, sun damage, all along the arms. You can shrink the arms. You can shrink the thighs. It helps with post-weight loss. We can get rid of tattoos. We can get rid of fine lines and wrinkles and large pores. It is endless. Okay, a few other key important things to let you know after your plasma fibroblast treatment. So no working out. So when we work out, obviously we're sweating. You can cause irritation and infection with those open wounds. So no working out at least for 4 days. No soaking in a bathtub and no steam showers. Please, again, don't touch your face. Let these scabs fall off naturally. That will all be more beneficial so that you heal quickly and smoothly. So after your plasma fibroblast treatment, please be patient. Full results can take up to 8 weeks, and new studies actually show it can even be beneficial up to 12 weeks. So again, be patient. If you're wanting a retreatment, I'm recommending to retreat at 8 weeks so that we have a better idea of how everything looks. So another key point to help you heal properly after your plasma fibroblast treatment. So we want to minimize any kind of irritation. So no working out. I know we don't want sweat. Sweat to get into those open wounds can cause irritation. So please no working out for at least 4 days after your plasma fibroblast treatment. No soaking in baths, no jacuzzi, no steam showers. Just very, very basic, simple things to do for the next few days. But trust me, the benefits outweigh the few days during the healing process. Okay, you just had your plasma fibroblast treatment. Now, what is the protocol to help you heal and get the best results you possibly can? Number 1, out of the sun. You have to be so careful of sun exposure for 2 months minimum. So we don't want, when we're driving, we have to make sure that we're protecting our face. Remember, the left side of us still those UV rays get in from the front windshield. Please protect your skin with a mask, a hat, sunglasses, SPF of 50. And what I like to tell patients, sunscreen's ingredients on the skin are only active for about 2 hours. So you have to keep reapplying if you're going to be outside in the sun. But at least for the first 2 weeks while you're really, really healing, no sun exposure. You really have to limit being outside. And then what I tell patients, so what you're gonna do is cleanse morning and night with a very, very gentle cleanser using lukewarm water, gentle motions, and then pat the area dry. And you're going to then be using my favorite. This is, can you see? Perfect. So what this product is a barrier repair. So we kind of need to protect your barrier of your skin as well as repair it. So you're going to be placing this product on first. Again, morning and night. Let it dry. And then we're going to follow that up with a moisturizer. This is another good one. So less is more with the healing process of plasma fibroblast. So we want the area to actually be on the drier side. So when you get like a laser chemical peel and you need to constantly keep it moist, this treatment is the opposite. We want it to dry out. So we want those carbon crustation dots to be on the dry side, that they fall off faster, okay? And then on days 3 and 4, you're gonna feel very, very itchy. So what I like to do is tell patients to use this soothing spray to help minimize any kind of itchiness, okay? And then again, SPF is gonna be your best friend. So that is the protocol for the next 2 weeks to help you heal and get the best results. When we are treating areas of the body with plasma fibroblasts, like the abdomen, the arms, knees, you want to have those areas be on the dry side. So if you're wearing clothing that's kind of keeping compression, that can actually lock in moisturizer. So please wear either, you know, if you have your arms being done, you want to have your arms in a loose top or even a tank top. Abdomen, yes, nothing on the midriff that you're gonna have a rubbing and have those dots fall off any sooner. Same with the legs. We just want to minimize any kind of friction so that these dots are not, again, falling off too fast, and then we're causing irritation and we're causing scars. So just loose clothing would be ideal. Okay, so we're doing plasma fibroblast today on Liz, and she's never had this treatment before.
Excited and nervous.
No, don't be nervous. You're in great hands. So her concerns were her forehead. She has a few fine lines, and we want to actually lift a little bit of her eyebrows so that we can help with the hoodedness she has on her upper eyelids. And then going down to her eyes, we're also going to do her upper eyelids to help shrink the tissue on her upper eyelids to help minimize the hooded eyes that she has. And it is genetics. I have the same thing. But what we're able to do with plasma fibroblasts is shrink the tissue so that it opens up your eyes, and it's minimizing the upper eyelid tissue so that you have more, so you can do like that flared cat eye, wing eye, your eyes look more open and youthful. We don't look so tired. Obviously it makes us look younger. And it minimizes us having to get so much Botox, which is, you know, a toxin in itself. And then we're gonna work our way to the crow's feet because she has a few fine lines, more on her left side, because that is her sleeping side.
It is.
And also, I don't know if a lot of people don't know this, but our left side, being that that's our driving side and it sees a lot of the UV rays, it does have actually more sun damage and fine lines on that side as well.
I didn't know that.
Yeah. And then we're also going to work our way to the under eyelids so that we can minimize any kind of dark circles, again, fine lines.
These fun guys.
Exactly. And just, again, make her look refreshed and younger. And then she has a few sun damaged spots on the cheeks, large pores. We're going to smooth those out. We're going to really work around the mouth because she wants that lip flip.
Yeah.
So it's going to look like she has filler, but she does not. It's all your natural lip border that we're lifting and shrinking the tissue on the upper lid that's between your nose. So we're going to work all around the mouth. And then she does have a few large pores on her nose that we're going to smooth out as well and make you look beautiful. And I know there's some areas on her stomach.
Oh, Yes.
So yeah, I'm excited. So we're gonna get to cleansing, a little light microdermabrasion, so that helps the numbing cream penetrate. We'll put the numbing cream on for a minimum of 30 minutes, and then we'll get started. Okay, so Liz's fibroblast treatment is done. Yeah, she did amazing. She did so well. So now we just cleansed her skin to get everything clean, to get that charness off. And now we're putting a cooling gel on, and then we'll put a post-procedure cream that has zinc in it to help with the UV rays. So when she drives home, she is protected.